For centuries, the hymen, a small, thin membrane located at the opening of the vagina, has been shrouded in myths and misconceptions. These misconceptions often center around the idea that the hymen is a definitive marker of virginity. This belief, deeply ingrained in various cultures, has profound implications for women's lives, impacting their sexuality, relationships, and self-esteem. This essay aims to debunk the myths surrounding the hymen, shed light on its biological reality, and discuss the harmful consequences of these pervasive misconceptions. By understanding the truth about the hymen, we can challenge cultural norms and empower women to embrace their bodies and sexuality with confidence and autonomy. It's time to separate fact from fiction and dismantle the harmful narratives that have held women captive for far too long. Many cultures associate the hymen with virginity, viewing it as a symbol of purity and virtue. This association often leads to the belief that a woman's worth is tied to her sexual history. This moralistic view can create immense pressure on women to remain abstinent until marriage. The consequences of these beliefs can be severe, particularly in cultures where premarital sex is stigmatized or even punishable by law. Women may face social ostracism, honor-based violence, or even death if they are perceived as having violated these deeply ingrained cultural norms. The pressure to conform to these standards can be incredibly damaging, leading to feelings of shame, guilt, and anxiety surrounding sexuality. It is crucial to recognize that a woman's worth is not determined by her sexual history, and that her value as an individual transcends these arbitrary and often harmful cultural constructs. Unfortunately, the medical community has not always been immune to perpetuating myths about the hymen. Misinformation and a lack of comprehensive sexual education have contributed to the persistence of these harmful beliefs. Some healthcare providers may unknowingly reinforce these myths by equating an intact hymen with virginity. This lack of accurate information can be particularly damaging for young women who rely on healthcare professionals for accurate and reliable information about their bodies. It is essential for healthcare providers to receive adequate training on sexual health, including the anatomy and function of the hymen. By providing accurate and evidence-based information, healthcare professionals can play a vital role in dispelling myths and empowering women to make informed decisions about their bodies and sexual health. Accurate medical information is crucial in challenging harmful cultural norms and promoting a more informed and equitable approach to women's healthcare. The media, including film, television, and advertising, often perpetuates harmful stereotypes about the hymen and virginity. These portrayals often reinforce the notion that a woman's value is tied to her sexual history, perpetuating the myth of the hymen as a reliable indicator of virginity. These representations can have a profound impact on how women perceive themselves and their bodies, contributing to feelings of inadequacy and shame. It is essential for the media to move beyond these outdated and harmful stereotypes and embrace more realistic and empowering representations of women and their sexuality. By challenging these harmful narratives, the media can play a significant role in shaping more positive and informed attitudes towards women's bodies and sexuality. Section 5. The Truth About the Hymen. Debunking the Myth. The hymen is not a solid membrane that breaks during first intercourse, as is often believed. In reality, the hymen is a thin, flexible tissue with a natural opening that varies in size and shape from one woman to another. Some women are born with a hymen that is already open, while others have a hymen that may stretch or tear during various activities, such as strenuous exercise, tampon use, or even just normal bodily movements. The presence or absence of a hymen is not an accurate indicator of virginity or sexual history. It's crucial to understand that a woman's sexual history is her own personal experience and cannot be determined by a physical examination. By debunking this myth, we can empower women to understand their bodies and reject the harmful notion that their worth is tied to their sexual history. Section 6. Harmful consequences of misconceptions. The misconceptions surrounding the hymen can have devastating consequences for women's lives. In some cultures, women may be subjected to virginity testing, a harmful and often traumatic practice that aims to determine a woman's sexual history based on the presence or absence of a hymen. Virginity testing has no scientific basis and can cause physical pain, emotional distress, and long-term psychological harm. This practice is a violation of human rights and must be condemned and eradicated. Furthermore, the belief that a woman's worth is tied to her virginity can contribute to gender inequality, limiting women's opportunities and freedoms. It is essential to challenge these harmful beliefs and promote a society where women are valued for their individuality and not judged based on outdated and discriminatory notions. Section 7. Promoting sexual education and empowerment. Comprehensive and accurate sexual education is crucial in dispelling myths about the hymen and empowering women to make informed decisions about their bodies and sexual health. Sexual education should be inclusive, age-appropriate, and address a wide range of topics, including anatomy, consent, contraception, and sexually transmitted infections. By providing young people with accurate information, we can empower them to make healthy choices and develop a positive and respectful attitude towards sexuality. Access to accurate information is essential for challenging harmful cultural norms and promoting a more equitable and informed understanding of sexuality. Section 8. Embracing body literacy and challenging norms. Embracing body literacy, which involves understanding and respecting our bodies, is crucial for challenging harmful cultural norms and promoting women's sexual well-being. Encouraging women to learn about their bodies, including the hymen and its variations, can help dispel myths and foster a sense of ownership and agency over their sexuality. It is essential to create safe spaces for women to discuss their bodies and sexuality openly and without shame. By fostering open dialogues and challenging societal expectations, we can create a more supportive and empowering environment for women to embrace their sexuality on their own terms. This empowerment involves rejecting harmful cultural norms and embracing the diversity of human bodies and experiences. Section 9. Conclusion. Reclaiming our bodies and narratives. It's time to reclaim our bodies and narratives from the myths and misconceptions that have surrounded the hymen for far too long. By understanding the biological reality of the hymen, we can challenge the harmful cultural norms that seek to control women's bodies and sexuality. Let us embrace a future where women are empowered with knowledge, autonomy, and the freedom to make choices about their bodies and lives without fear, shame, or judgment.